Thank you so much, Chairwoman Brownlee. And I also want to thank Representative Radowagen for asking about rural VA healthcare. And then I'm also going to say that although I'm a 24-year military veteran, I also am a provider and provide services under Veterans Choice and the Mission Act to veterans. I've had outstanding care and outstanding reviews. So I just want to put in my 2 cents for physicians who are in the community. As I said, I am a veteran who served both as a nurse and a physician in the United States Army for 24 years, also the former director of the Iowa Department of Public Health, and I understand firsthand the importance of standards of care and quality of care. I am gravely concerned, as Representative Dr. Greg Murphy, over the VA National Standards of Practice Initiative to the extent that it could result in VA facilities moving away from the team-based model care to a nurse-only model. That could put the health and lives of veterans at risk, and I'm concerned that it's being considered without consultation with stakeholders. In August, I sent a letter urging the VA to uphold the team-based physician-led anesthesia care team model as the national standard of practice for that specialty to ensure the safety of our nation's veterans, especially because many of our veterans are sicker and at higher risk, so they have a higher risk profile. Ms. Oshinsky, the team bed physician-led model anesthesia care, for example, was formalized in 2017 after a process that involved over 200,000 comments by veterans. Does VA plan to seek comments from stakeholders regarding this new policy? And if so, when and how will stakeholder feedback be solicited, and how will it be incorporated into the final product?
Thank you for your interest in this issue. We are at the very beginning stages of looking at, and really the issue is far broader than the CRNAs and the anesthesiologists. It's ensuring that all the licensed professionals that we have work up to the highest level of their license. And so it involves a whole lot of things, a whole lot of areas besides anesthesiology. What I can tell you is that we are in the formulative stages of putting together groups for each one of these different areas, which will involve comments from those who are interested in the community, from veterans, but also making sure that legislatively we are doing everything that we need to do. So that is, again, at its very beginning stages. We are putting the policies together and know that this is so that we can stretch our employees to make sure that we can deliver the most care to veterans. This gets us better access if we can make sure that everyone is working to the top of their license. But I certainly hear everything that you're saying.
If I may, yes. You know, in a federal system, the top of a license has different things. So at a state level, you know, people may be limited. The top of their license may not be the same thing as another state's top of the license. So your standards have to take into consideration that as well. I do have another question I'd like to ask while I have time, Ms. Oshinsky. If you can elaborate on the impact of the global supply chain disruptions, how they're having an impact on the VA healthcare system, and steps that the VA is taking to mitigate that impact. For me, the supply chain is a tremendous issue. It's disconcerting to hear this administration say there's very little that they can do about that, where I already have some suggestions and solutions that we can help with some of the supply chain issues that we have now, as we're seeing out of the Port of Los Angeles. So can you tell me the impact they have on VA healthcare, and are there things that you're doing to help mitigate that?
Yes, one of the things, thank you, Congresswoman, one of the things that we try and do is that in our Health Operations Center, we have dedicated one day a week to look at what are things that people are finding that we are getting shortages. So we hear from around the country, each of the network leaders talking to us about where there may be issues that they're facing with delays in deliveries. What we do then is try to reassess and move supplies around our system so that we are taking care of anybody who's coming up in short supply. You know, recently, some of the issues that have come up regard tubes. And we need to move it. Yeah, as a provider, you probably know those things. So that's one of the things that we do. We may move something from Dr. Boyd's VISN to Dr. Bergman's VISN because we have a variation in what availability we have. So that's the main thing. And I'm talking mainly from an operational perspective right now.
Thank you so much. I thank all the panelists for their presentations and testimony. And thank you, Chairwoman Brownlee and Representative Bergman. I yield back my time.
Thank you.